Dr. Todd Shatkin is back with us with our Great Look segment from Aesthetic Associates. We're going to be talking about going from dentures to implants and having the beautiful smile you always wanted without having to take this plate in and out, which a lot of people hate. Good morning.
Right.
How are you?
Good morning, Linda. It's great to be back again.
Thanks.
Yeah, you know, we've talked a little bit about this in the past, but I wanted to refresh everybody's memory because over the years, people didn't have very many options. If they had dentures, they were stuck with dentures or partials, and you know, if you don't have enough teeth to support bridge work, you can't do it.
Right.
And if you wanted to do conventional implants, it gets very, very expensive and time-consuming. It can take 9 months to a year to complete. So what we want to show is the first technique, the procedure I developed about 3 years ago. This particular patient, if you can zoom in on that, is a patient that's wearing a partial denture. You can see the wires on the teeth and the clasps. And let's look at the next.
Because the next thing now, this is what's inside their mouth, right?
The entire roof of the mouth is covered with plastic or metal, and they have those wires. And this is very cumbersome for people to put in and out every day and morning, clean it. You know, sometimes you have to use denture adhesives and things like that to hold it in. So if a patient has an upper or lower partial or a full denture, and they're unhappy, they can come in. What we do is we'll take x-rays, do a consultation, make sure they're candidates for this procedure. And then this is the before, the missing teeth.
These are the teeth that are gone without the denture, right?
Correct.
And here's the other side. So this might be you at home. The front teeth are the patient's, but these are all gone in the back.
Right.
And that's why they wear the plate.
Right. So here we have, after we've taken impressions and done the consultation, our laboratory will fabricate these permanent porcelain fused to metal crowns along with surgical guides that we use in the placement of the implants. And the next picture will show the implants in place, the mini dental implants that we've talked about before. And the great thing about the mini implants is there's no cutting, there's no stitches, there's no swelling or healing. It's just done through a tiny little pinhole in the gum. And it's a very simple, non-invasive procedure.
Wow, and the tooth then snaps onto that.
Then we cement them on.
Cemented, so they're not coming out.
Right, and here's the teeth placed.
Now look at that.
With
These are
the permanent cement. And the next picture will show both sides done.
Wow.
And this is accomplished in about an hour.
This is amazing.
Without any surgery and no bleeding.
And no more plate in the middle of the mouth.
And no stitches.
That's amazing. Your patients have to be absolutely thrilled.
They really are. And like we do these for single teeth, anywhere from 1 missing tooth to, in this case, 6 teeth.
Wow.
Or you can do it for 12 teeth. You can do it for a complete arch if you need it. So whatever the patient needs, we can usually do it in one visit.
Well, if you have a question, Dr. Shatkin is here, 644-9840. Can you put in front teeth like that too?
Yeah, any tooth in the mouth, as long as the bone looks good. And the great thing about the mini implants is you don't need a lot of bone. You just need enough. So with conventional larger style implants, you need to have quite a bit of bone, and sometimes they have to do bone grafts from your hip or from other areas of your body to fill the bone. And with the minis, you just need a very small amount, and so usually patients are candidates for this.
That's amazing. That is absolutely amazing. And I bet you everybody who comes in and says, I did not know you could do this. I thought once I was in dentures, that was going to be it for the rest of my life.
Most people are not aware that they can have a tooth replaced in less than an hour without any major procedure.
Wow.
You know, and the great thing also is you don't have to grind down your healthy teeth on either side like you would for a fixed bridge. So if you had a tooth, say, on either side of a front tooth, usually they would cap those teeth. We don't have to do that. We can just replace the missing tooth.
Now, is the new tooth made of the same material a crown would be?
Yeah, porcelain fused to either porcelain fused to gold, or we even do the all porcelain ceramic fused to zirconia, which is like a quartz type material.
Well, so you might even end up with a brighter smile if you can bleach the front ones and then have them all match.
Yeah, we can do that.
That's terrific. That's really an amazing thing. And how young can you perform that on? I think of kids who get teeth knocked out playing sports.
Well, you have the kids that get the teeth knocked out. You also have children who are born congenitally missing 1 or more teeth. And we can do these on people at age 15 or older.
Okay, so that's pretty much where your bone now has matured and you're ready to go.
Right.
That's incredible. I really love that idea. And you have talked about this. You've gone around the country, haven't you, if not around the world?
I've traveled all around the world, actually, Linda. I just came back from Australia and New Zealand. I was in Mexico last year and England. So we teach this program all around the United States to dentists to teach them how to do this procedure, and then, of course, in foreign countries as well.
How thrilling. We have a phone call.
Exciting.
Somebody would like to talk to you about this, or maybe another dental matter. Hello?
Hi.
Hi, caller, are you there?
Hello?
Yes, go ahead, please.
Hi, I was just wondering if you could tell me what the ratio is of getting food particles under the plate, underneath the teeth that are implanted.
Okay.
You're talking about if the implants are placed?
Yes.
You get far less debris or food under these fixed implant bridge work than you do with a removable partial. Of course, the partial can be taken out and cleaned. With these, you need to clean it in your mouth. It's very much like cleaning your own teeth again. We recommend a water pick type device, electric toothbrush, and we show you how to floss and whatnot underneath it. It's very similar to cleaning fixed bridge work or crowns.
How long might we expect these teeth to last?
They're going to last a long time. We've been doing this particular procedure for about 7 years. We've had over 98% success with them, and people are doing great. Conventional implants have been around longer, about 25 years, and they've had very strong success. I would estimate 15 to 20 years is a good average life expectancy, but it might last longer than that.
Now, does insurance take care of the partial if you need that? And how is insurance doing with this? It's new, so I'm always assuming they're not going to pick that up.
Well, you know, insurance companies try to get out of paying as much as they can, but we have been successful getting some payment for the crowns on top of the implants.
Oh, that's good.
Many of the insurances don't cover the implants, but they will cover part of the crowns.
Don't you feel like in the future they will?
I think they're coming around
Yeah.
because what they're finding now is that if we restore people's mouths to health, they're going to have fewer bills in the future.
Sure.
If you leave teeth missing, then the other teeth shift and they have more teeth lost.
Right.
So I think insurance companies are realizing that preventative maintenance and replacement of teeth is better than letting people deteriorate.
Yeah, and I think we're seeing that already. I mean, now all of a sudden we're seeing insurance companies pay for you to go to the gym. You know what I mean?
Right.
It's like they want to keep you. They'd rather keep you healthy than pay for you when you're sick. So that, to me, you know, is showing that they're moving in the right direction.
Absolutely.
Yeah. That's incredible. Now, genetically, some people are predisposed to lose their teeth earlier than others. There can be that
yes,
component
absolutely.
there, too.
Periodontal disease can run in families, especially if you compound that with smoking or bad habits. You know, drinking, smoking, things like that can cause more periodontal problems. And so, if you have a predilection to gum disease, if your mother or father have complete dentures, you got to think to yourself, why did they have complete dentures?
Right.
Or your grandmother or grandfather. And you need to think more seriously about taking care of your teeth.
Absolutely. You know, it's interesting. I bet you see a lot of life changes after someone is given the smile they've always wanted. Maybe they don't want to smoke anymore because they just love their smile. You know what I'm saying? It's like when you're happier when you look in the mirror and you smile and you finally like what you see back, it changes a lot of behaviors.
Absolutely. And you know, the New York State Dental Society and the New York State Dental Board has now forced dentists to take courses on helping patients stop smoking.
Really?
And so we do encourage our patients to stop smoking because it's healthy. It's healthy in New York, and they want that to be done. And so sometimes all a patient needs is some encouragement. And if their teeth are yellow and gray because they smoke and drink a lot of coffee or whatever, and they have a procedure to improve their smile, all of a sudden they say, you know, I don't want to do this anymore. I want to keep, I spent some money on my teeth, and they look good. I want to keep them
I
nice.
want them to look that way.